morning. I'm Kristy Bird MaKieve, and I'm the CEO and GME Administrator for Healthy Rural California. Today is Sunday. I realized that Scott and I were talking on Friday, and I committed to writing something, and I'm just not in the space to write. So please accept this video recording as a way of explanation on the Psychiatry Residency HCI grant. And specifically, I want to talk about accreditation, initial accreditation, and the funding that is needed in order to successfully launch the psychiatry residency. This does apply to family medicine as well, so I'll probably be sharing this with that team, just so that they have an understanding of all of this funding from the state of California, which we are very, very grateful for. It has been the impetus, the champion for us moving forward and actually launching residency programs in the rural and underserved area of Northern California, specifically centered in Butte County. So if I may, and I'll try to keep this as short as I can, there's so many things that interrelate, so I may be going over, and then I do want to spend some time this afternoon writing this up. So I have a conference and I need to leave at 11 a.m. It's 9 now. I didn't realize I was leaving that early. It's a conference so that I can maintain my certified association executive credentials, and it's very important to me. So whether or not I get to write this out is yet to be seen, but at least you'll have this video. Okay, so the Psychiatry Residency Award from HCI to Butte County Behavioral Health was submitted in 2020, and it was a point in time where we were being guided by our consultants, but we ourselves did not know very much about GME or the process of getting accredited and launching a residency program. So we're even more grateful that the state has said that these funds are available to launch the psychiatry residency, because it was, we were all learning about this in the process. And we realized in 2020 that as amazing as this award was, it wasn't to be drawn down until we reached accreditation. And we didn't know when that process was going to happen. So now, in April 2023, looking back, I can articulate things so much better, and have so much more understanding of the process, what it entails, the costs associated. And so this is my explanation. And I will state that in 2020, we had a feasibility study, and it was conducted by Wipfli, and Kiki Nocella and Maggie Fassbender, who are our consultants all the way through to the beginning of this year, 2023. They put together a financial plan and a budget, and then Holly Drobny was the county employee that we worked with to submit the application to HCI. At that time, it was called OSHPA. That application, that budget was to get us to accreditation, but also to the beginning of the first cohort of residents starting. There's an accreditation conundrum, which is that you're not allowed to recruit for the residents until you are accredited. And then between that accreditation and the first cohort starting is a whole bunch of expenses that have to happen. We have to install MedHub, which is the software we're going to use so that the faculty and the residents and our staff can track their time, which facility they're going to be at, et cetera, et cetera. That's just one expense. That's an example that we weren't going to spend money on until we got accredited. So accreditation through ACGME is actually never done. This is something that I've really had to wrap my mind around in the last year and a half, which is that we have to have a GME committee. We have to be a sponsoring institution and follow all of that accreditation. And you can't launch the psychiatry residency without the sponsoring institution accreditation in place. So all of those expenses related to psychiatry are related to, that's the whole kit and caboodle. I mean, we literally would not be able to apply for accreditation to ACGME for psychiatry until we had that sponsoring institution piece in place. And that was costly and time consuming as well. You have to have staff and you have to continue paying them throughout the process. And then you have to show that you have that staff paid and dedicated time for that particular residency. So there's a whole bunch that happens ongoing, and it's required as a part of the accreditation. So we're going to be installing MedHub in June of 2023. And really, again, that's just one specific tangible example of expenses. And then we have our program coordinator, we have a project assistant, and we have to pay the program directors and the DIO, myself, right? So all of these expenses continue on. Accreditation just doesn't make all of that go away. I'm going to talk a little bit about the accreditation steps, where you will see in the letter that we received in February 2023 that we received initial accreditation. And that is really important because it is what gets us into their ACGME system, their software. It's a program called ERAS, which is what is the national platform that all of the medical students apply to. It opens up mid-September every year. And then from September to March next year, 2024, March 15th is match day. And it's just such an exciting day. It's where all of the medical students, or those who are MDs or DOs already, maybe they took a gap year, we don't know. But all of them match into their residency program. And so it's just really super exciting. But that is what we have to work toward this year in order to get to get the applicants to Healthy Rural California. If we don't have applicants, then we don't have a psychiatry residency. And so initial accreditation is also, I'm going to put it into terms of the whole application process, right? So we submitted our application for accreditation to ACGME, and as a different system, the ADS system, just in case anybody wants to know, ADS. And that was August 30th was the time that our DIO was able to actually submit. There was a good week of his life that was taken away because ADS is such a complicated system and things didn't work, and we were trying to get rural designation, which we did not get. It goes on zip codes of the facilities, but that's okay. But it kind of added a whole bunch of extra steps to the process. But the actual submission was August 30th. And to apply for accreditation, you really only need about 80% of the program. You have to show the exact requirements. You have to show which facilities will be having the residents and what faculty will be teaching them. And that's, oftentimes it's a physician who has to have all this faculty development and training themselves to understand ACGs and ACGME's expectations of them, the goals and objectives of that rotation, what they need to be teaching those residents, and how are they preparing to teach those residents to the standards of ACGME. And so when we got initial accreditation for the psychiatry residency in February 2023, it was only 80% of the curriculum. So I'm going to break down the psychiatry residency. It's a 4-year curriculum. So we had to define each month and the faculty and all of that for years 1, 2, and 3. But the fourth year is all electives, and those electives did not have to be defined. They were just noted, and a brief explanation was available to show. So really only 80% of the application had to be done in order to reach accreditation. And there's some, and then we had to do, so that was submitted August 30th. ACGME then had to do a site visit that was scheduled for November 9th. We had a lot of development that we had to do, faculty development and sort of getting them, we have to show to ACGME that we're working with our faculty to, make sure that they're prepared to teach the residents. And all of that was required in this application and the site visit November 9th. Then that application went to the Psychiatry Review Committee. Their agenda had to be finalized November 11th. And we confirmed we were on that agenda November 11th. And then the agenda was being set for a February 11th. I think it was February 11th, actual review committee meeting. My guess is that, there's 216 pages to this application, and we were not the only ones. I think there were 6 or 7 other psychiatry residency programs that were received initial accreditation in February. So between November and February, that review committee had to get all of those applications, probably read through them, and then they all sat around in those 2-day meetings to discuss each of the viabilities of each of these applications. And so then they said, yes, you have initial accreditation, and that's the letter that they sent in February 2023. But I will tell you that is only 80% of the way. So we are now finalizing all of the agreements for the electives and making sure that those faculty have agreed to the goals and objectives, teaching the residents at their facilities. So it's the remaining 20% has to be done. And and then we will have a final site visit and final accreditation once the residents are on board. And ACGME likes to come in and say, okay, you all got initial accreditation, you made all these promises and these commitments. Is this first cohort actually receiving that education? And they'll ask the residents, and the residents then have to, give feedback. And if it's not positive, it would be bad. And the other reason I'm articulating this is that the funding that is needed for that first cohort to arrive in June 2024, we need to continue paying our staff because they are the ones doing the recruitment and going out there. And we have Healthy World California has no other funding for this. I mean, we have to get to the teaching health center funding. We will be applying for that in the fall when the applications open up. And then that funding doesn't get to us to pay the residents until probably the summer of 2024. So initial accreditation in February 2023, fantastic. It was the ultimate goal in order to launch, but it's not the endpoint by any stretch of the imagination. And so this HCI award through June 30th, 2023 is actually incredibly important and will help us get to that first cohort starting in June 2024. We'll be entering into that system that I mentioned earlier called ERAS, it's ERAS. And that opens up for the medical students to apply. I think it's September 15th, or it's usually right around that date, if not exactly September 15th of this year. And then they all apply, and then the match day is March 2024. And then they would start in June 2024. So I hope that this explains why we are asking of our county partners, Butte County Behavioral Health, to communicate to HCI why this is, funding through the end of June per the original grant is important. I'm looking at our other grant for family medicine, which was just awarded to us and is phenomenal. And I'm seeing that secure residency accreditation is also the end point of that grant. And so I am very, very, very much wanting to help explain. I can do a webinar, whatever you need from me and others who are familiar with this process to describe why accreditation is such a huge milestone. It is truly what we need in order to fully launch, but it is by no means the end of the funding that is needed in order to actually be successful. And I'm seeing that for the family medicine residency grant as well. So I'm more than happy to do more discussions, meetings. I live in Sacramento, whatever is needed. I can provide more insight onto this accreditation process regarding funding. So I'm looking at the family medicine portion. My Callie Erner is our new controller, and she sent this to me, and I'm actually really wondering about that family medicine grant as well, because although I think that one is saying that we would get 100% of the full award once we achieve accreditation. So if that's the case with family medicine, perhaps it could be applied to the psychiatry one as well, where 100% of the 1.8 million for psychiatry could be given, because we did secure the accreditation in February 2023. Anyway, so lots to ponder. Please do let me know if there's any more information that I can share or answer questions for. Literally, I'm going to cry. I'm thinking of the psychiatry residency and how hard we've worked, how many people across the country have been cheering us on, and to think that if we don't have that full funding for the psychiatry residency, that we're not going to make it. We won't be able to keep our doors open until June of 2024, and that first cohort starting. And it's been such a long, hard road, such a big roller coaster, so many ups and downs. And yet our community is so excited. And it's just the work of putting this new residency together has brought hope to the community. I hear this all the time, that what we're doing with Healthy Rural California, establishing graduate medical education, is bringing hope to the community. For psychiatry in particular, the needs are so great. We actually did a tour of Enloe Medical Center, who is not a partner at this time for psychiatry. Their mental health services are not nearly as strong as the VA's, which is our primary hospital for the psychiatry residency at this time. But we are stepping into the GME space with Enloe Medical Center for the family medicine residency. And so we were touring them on Friday, and the pediatric physician and team was basically articulating this need for the psychiatry residents that's just heartbreaking, that there's so many children coming into Enloe Medical Center that are just crying out for mental health support. So, and then in terms of Enloe, we're also talking to them with their new cancer center that they're building. They have a cancer center, but it's they're creating a new building to expand. And they really want the psychiatry residents to work with their patients as they're getting, cancer diagnosis and treatment, and helping support them as well. So there's such a great need, and we've come so far, and just needing the funding to keep our doors open and continue recruiting that first cohort. And so if we could get 100% some of the full award for psychiatry, it would be phenomenal. So thank you so much for your time. I hope you have a wonderful weekend, and we will follow up soon. And Scott, my commitment is to send you something in writing. But in the meantime, if I don't get to it because my conference is starting this afternoon, I hope this will suffice. Okay, you all take care.